Hi, this is Dr. Scott Hirose from Endospecialists. Here are some common questions we get all the time. Why is my old root canal hurting? Or, I already had a root canal done, why does it need to be redone? Generally, the situation boils down to bacteria and other microbes infecting the inside of the tooth. So let's do a case walkthrough to talk about where those microbes live and what we do to get rid of them. Looking at this set of teeth, we'll focus on an upper left molar. And switching to an x-ray view, we can see the crown of the tooth, 3 roots, and the expected canals inside each root. Notice that the expected canals stop short of the root outline. This is intentional and has to do with how a 3-dimensional tooth gets projected into a 2D image. The true canal almost always stops short of the end of the root on the x-ray. Now we can see the existing root canal fillings stop short of the expected length, possibly leaving unclean canal space which could harbor bacteria and other microbes. We also took a 3D scan of the tooth. In this cross-sectional view, we can see the existing root fillings highlighted in blue, and one of the roots likely has an extra canal space to be cleaned out. So, why do root fillings end up short? Sometimes there's sharp curvatures that are difficult to navigate with our tiny instruments. Other times there's severe narrowing or anatomical constrictions of the canal space. There can be obstructions, debris, or complex anatomical features which block progress down the root. And sometimes canal can be very small as a human hair, and may be covered or buried deeper in the tooth like the extra canal we'll be looking for. Lastly, a root canal appearing short does not necessarily mean there's any problem. A tooth can look very different from different angles, especially considering anatomical variations. A root canal retreatment like this can be very tricky when there's a big difference between the angle of the previous root filling and the angle of the rest of the canal. It can be challenging or impossible to gain access to the rest of the canal to clean it out. Fortunately, I was able to clean out the full lengths of the canal and put in a new root filling material, and most importantly, the pain from this tooth resolved. And at the 6 months follow-up, the tooth was still feeling great, the bone looks good and free of signs of infection, and we have a good angle to see that extra canal that we located, cleaned, and filled. Now when we look at an x-ray, it can give the impression that the canals are simple straight lines inside the roots, but the true anatomy of the teeth can be very complex, with lots of webbing and tiny interconnected spaces that can be too small for our metal instruments to reach. This is why we like to use additional tools to help flush our irrigating solution through the tooth to clean out these kinds of microscopic spaces and gives the best chance of having a healthy, infection-free tooth. Here in this tooth, we used the General Wave machine. Here's the before and after images. When we look at x-rays though, it's important to remember that pretty white lines on an x-ray do not constitute success. Those lines just make us more optimistic. Success relies on numerous biological, patient, and provider factors. Well, thanks for watching, and I hope you found this helpful and informative.